Hi everyone, my name is Mana, and on this slide I will be talking about patient education and nursing implications. So first, to educate, we must first consider the group at hand. In this case, we are educating the geriatric population, which comes with a lot of challenges. There are a lot of things that may prevent this population from being educated. We must consider if they have the right resources and tools to understand the information being displayed to them. Once we do this, we can educate the elderly on what is most common to them. Lots of diseases are common in the elderly community. That's why education is very important. We want to provide education around ways they can prevent illness and further illness if they do have it. We are not only thinking about their physical well-being, but their mental, emotional, and spiritual well-being as well. We know that depression is very common in this age group, so that is a very important consideration. Education around this topic and how to seek help is important. Next, we want elderly patients to know what diseases are most common at their age and what they can expect to see if they have the disease. We want them to be aware of the symptoms so they can reach out if they notice something is off. Health promotion is needed even when we are old. It is never too late to stop smoking, start exercising, or changing their diet. Many people might think, oh, well, I have the disease, it's too late now, but we must educate them that it is never too late. We can always slow down and prevent the disease from getting worse if they adhere to a healthcare routine. For example, heart diseases, lung diseases caused by smoking, or diabetes can all be slowed down. It's important that the elderly patients are aware of this. Some may comply and some won't. Next, we are educating them on their hearing and seeing needs. As we get older, our senses decrease. Therefore, we must take this into consideration, that many patients will have hearing and seeing problems. This can interfere with their ability to learn. We must also educate these patients on ways to reduce accidents associated with hearing and seeing problems. For example, making sure there is enough light in their home environment to prevent tripping and falling, and making sure there are no loose rugs in their home. We must also make sure they know where to get the proper eyewear to see and the proper hearing aids to hear. This will reduce their risk of injury. Next, we must educate them on the use of medications. Lots of elderly are not educated on how to use their medications. There is a risk of polypharmacy with this group because many will go to different doctors and get different prescriptions for many medications. This increases their risk of injury and even death. Therefore, it is important that we tell them to monitor their medications, and when they take it, always inform their doctors of any vitamins, minerals, herbs they might take besides their medications. If they cannot monitor it themselves, we must make sure there is someone available who can do that for them. This leads me to the next point, which is to keep up with their doctor's appointments. It is vital that the elderly are getting checked up regularly and that they have the necessary resources to find the right doctor and go to their appointments. Lastly, in disease prevention, we want to know when to seek help. We want to let them know that there is help whenever they need. We should provide them with the resources for physical, mental, and spiritual help. If they are having physical symptoms, we must let them know they should call for help immediately without hesitation. Lots of elderly patients feel like they are a burden, which is why we want them to know that this is not the case and that their life is valuable. Writing down the resources available in their community and providing them or their family members with phone numbers and contact information to those resources is important. And lastly, we want to make sure that the family members and caregivers are educated on the same things as well.